Welcome to Credentialing Chronicles, where we spill the doctor's tea, honey, hotter than your morning coffee.
And we're spilling it across America, state by state and license by license.
Ooh, I'm Shannon, and honey, she is Nylene, and we are just a couple of sassy credentialing pros with front row seats to all this crazy chaos.
Yes, from coast to coast, fraud scandals to hospital drama they hoped you'd never find.
But we find it, girl. So grab your coffee, your compliance checklist, and what, Nylene?
And let's get into it.
Hell yeah. Well, Nylene and Shannon sitting there talking about you while you pull up a chair. They holding everybody.
Hey, everybody. Welcome back to Credentialing Chronicles. So we're spilling the tea all across America. And the tea, honey, today is hotter than ever. We are heading straight with you all in tow to Idaho, a state people picture as quiet mountain towns, farmland, and, wide open spaces. But Nylene, what's really happening over there, baby?
Well, when we take a look at what's happening in healthcare out there, it's anything but quiet. We are seeing more provider shortages, political turmoil involving hospitals, some controversial stuff happening, doctors leaving the state, and, of course, my favorite, plenty of criminal cases.
Plenty, honey, in the middle of nowhere, right? And then the other thing that we were looking at is the rural hospitals, y'all, are hanging on by a thread. So, let's get into it today. And here we go about Idaho.
Oh, I like that. You rhymed and everything.
I know, I rhymed and everything. I'm ready for y'all today.
All right. So Idaho is actually pretty interesting because, like you said, there's a lot of rural regions and very few providers. Yeah. Credentialing timelines suddenly become a little bit more than compliance. And now that I'm also in a rural area here in Georgia, you can really tell how credentialing sometimes gets not treated the same. And then not only that, there's a limited access to care. So in rural areas, you got to depend a lot on telehealth. And I'm talking all kinds of telehealth. You got to depend on nephrology, cardiology, endocrinology, all those ologies. You have to depend on telehealth. So it's pretty interesting, and the access to care is really limited in rural areas.
Exactly. The nearest specialist, is 2 to 3 hours away from some people. And a delay in privileging or credentialing could really literally mean community loses access to providers. So I would imagine that the credentialing out of Idaho has to just really be spot on. And if it's not, boo, call AQC. We got you. I'm just saying.
Well, exactly. So, that's why we have to really dig into Idaho, see what's happening behind the scenes and why credentialing professionals are really under enormous pressure to keep things up to date and compliant.
And so, I guess, what can we say, but let's spill the tea, Nylene. And you know what? Well, let's say if you are listening from Idaho and we've gotten anything wrong, remember, we're researching, we're checking multiple sources. But if you have a better story, if you know more, you do. So you have to call us, text us, what else? Comment. What else, Nylene? What else do they do?
Yeah, let us know. Direct message. We're on Facebook, Instagram, all the things. And we love to hear from you guys.
Before we even talk about scandals of politics, because that's, your wheelhouse, we have to really talk about the workforce crisis that is happening out there. Because Idaho has one of the most severe physician shortages in the country, and I never knew that. I never knew Idaho. Did you?
No. You would think, we just talked about Hawaii and Alaska, but I guess somebody always wants to go there and nobody really thinks about Idaho. I don't know.
I might go there because, I hear they have beautiful sunflowers. They have sunflowers in Idaho? Or is it Kansas? Maybe, I don't know. We're going to find out on the Spillin the Tea across America. But really, according to the UW Department of Family Medicine Physicians Workforce Analysis, which I think Idaho ranks 50th, y'all, in the nation for primary care providers out of 50 states.
That's crazy. So that means that the state is literally at the bottom of the national rankings for access to primary care providers. I can only imagine what the specialists look like.
And you can't live there if you can't find a doctor, Nylene.
True.
Well, I guess according to the same workforce data, Idaho has roughly 174 physicians, y'all, per 100,000 residents. And this is coming from 2021.
That's an appointment every how many years?
100,000. So could you imagine, y'all? They are working their tail off for these physicians. I mean, for comparison, many states, y'all, they exceed about 250 physicians per 100,000 residents. And so, y'all, they haven't even hit 200. They're at 174 providers, physicians for 100,000 residents. I mean, that is definitely shortage.
Well, and when we narrow that and specifically just look at primary care, it becomes even more concerning because according to that workforce data you showed me, Idaho has only 64 primary care physicians per 100,000. So that 174 included all kinds of doctors.
Oh, so that was even the specialty.
Yes. So when you're looking at primary care, is down to 64.
Y'all, how are y'all seeing people out there? If you're a resident in Idaho and you're listening to us, please comment and tell us, how long does it take for you all to see a doctor? Tell us. We want to know. I mean, Nylene, it just seems like, combined that with the population growth, because I hear people are moving out there. According to state demographic data, Idaho's population has now surpassed 1.93 million residents. And this is as of 2024. And when I'm saying 1.93, that's a lot of residents, but not a lot of doctors.
Right.
What are y'all thinking? Even in between, 2023 and 2024 alone, the state added more than, I'd say, 150,000 residents, representing an 8.2% population increase.
That's crazy. So the population is growing and apparently rapidly, but the physician workforce isn't keeping up with the same rate. It's almost like gas prices, We can't keep up. Our incomes are not going up at the same rate as the gas prices. It's kind of a problem.
Honey, I done paid so much for a half a tank of gallon today. I said, oh, Lord. But I mean, really, when we're looking at it, according to the workforce reports, Idaho has approximately about 3,180 physicians providing direct patient care as of recent force counts. And so when we're looking at it, the shortage is just...
So that means that each one of those doctors is responsible. So those doctors are responsible for caring for almost 2 million people. That's crazy.
They're tired. They're tired. And rural communities, when you're looking at everything, are the most vulnerable. According to the same workforce statistics that we were looking at, 3 Idaho counties, y'all, literally have no practicing physicians at all.
You can see how that could really affect your credentialing people and friends, because they face enormous pressure. Because when hospitals then recruit a physician in a rural region, the entire community may be waiting for that doctor to start.
And could you imagine, I bet the medical staff professional population is a little low out there as well. I mean, if they can't find for doctors, how are they finding MSP staff?
Right.
I mean, really?
Yeah. And so what happens is credentialing departments suddenly become now the gatekeepers of access. They're verifying, of course, everything that we normally verify, education, training, malpractice, but they're also working against urgency. And then they also have to keep their patient safety. So are they just taking any kind of doctors, or they're lowering their standards because they need the doctors? I mean, that is a true question that we have to ask ourselves as a rural healthcare provider, physician area within a state. What kind of doctors are we letting, and how are we credentialing these doctors? And hopefully to obviously the same standards, but it can definitely add added pressure.
So what I was thinking, exactly what you're talking about, is I don't understand how they're able to just function, to be honest with you, right? Because everything you're looking at credentialing takes, sometimes 30, 60, 90 days. And so what is happening to these doctors that are coming on? Let's say you finally find the great doctor, you finally give them I'm sure you have to give them some kind of sign-on bonus, and then boom, you're now in credentialing waiting. According to the Idaho Rural Health Association, they've kind of looked at travel times for specialty care and how some of that can exceed 2 or 3 hours, y'all, in many areas. And, so patients may have to drive, I'm talking literally across the state to see a specialist.
So y'all are really spoiled if you have the doctor down the street. Well, and that's why I bring it back to telemedicine. That's why telemedicine is so important for states like Idaho. But that doesn't mean that you have to not credential them. You still have to credential them. And
monitor even more.
Yes.
I mean, hospitals have to verify providers who live in completely different states and know those standards and know what they're looking for. Does that state have a CDS? Do they, they need to verify that CDS as well? I mean, there's, literal things, that you have to look for when you're credentialing for telemedicine providers.
Yeah. And they often have many licenses, which this is why for states that have so much rural health, it's imperative that you have a system that you can verify all 50 licenses, because these doctors, especially in the hospital that I'm at now, we've got telemedicine with doctors have 30, 40, 50 licenses. I know y'all see it with radiology, but did you know it's a thing for cardiology and nephrology and all these other specialties? And that's why we need systems and programs like Baton, where we can plug in an NPI and get me all the primary source verification that I need. Get me all of their licenses. Get me all their DEAs. Run a report. 1, 2, 3. So guys, check it out. batonhealth.com. It is a lifesaver, especially if you're in rural health.
And yes, it is.
And you have to look at also these credentialing by proxy agreements. A lot of these telehealth companies will go ahead and get certified, right? Or they'll get accredited. They'll get accredited so that then they can do the credentialing by proxy agreements. But then you have payer enrollment issues. Do you accept assignment in rural health? Just like I said, we're credentialing all of these doctors, but maybe we don't have a provider enrollment specialist, so we're not even billing for these consults. So a true financial impact in these rural areas for access to healthcare, access to employees, right? Somebody to do the work.
I mean, we could just, talk about that literally for days, because rural hospitals, we need to do a whole segment on them, saying how can we help them and make sure, because, I know that the credentialing people down there must just be having such a hard time. But we're going to go and talk about, hospitals under political attack. I mean, this hospital, is been going through a lot. We like to bring it to your attention. One of the most shocking healthcare stories to come out of Idaho that I seen was, according to reports from the Idaho Capital Sun and also the Idaho Statesman, I believe they're the two reporting sources, St. Luke's Health System, y'all, became the target of a political campaign after activists accused the hospital of kidnapping a child during a medical case.
What?
Nylene, the allegations spread rapidly, boo. Honey, I'm talking, the campaign was led by some activist. I don't even remember his name. It's crazy.
That is insane. Well, what's crazy is, right, what happened and what followed was something that hospitals rarely experience, which is healthcare workers were looked at and followed online. Protesters showed up outside the hospitals like true on stalking. Staff members received death threats.
Can you believe it, y'all? I mean, according to media reporting, demonstrators even protested outside healthcare workers, y'all. Were literally their homes.
That's crazy.
I mean, the situation escalated so drastically that hospitals implemented security lockdown times, and emergency patients were literally diverted to different hospitals, you guys. And so when you're thinking about that, you're literally now, okay, we have all these shortages, we have all of this. Now hundreds of medical appointments, guess what, y'all? Canceled. Now we can't even see doctors that we do have appointments with.
Wow. So eventually the hospital filed a defamation lawsuit. And then, according to court records, a jury later awarded more than $50 million in damages against this person and his organization because he was riling up the community against the hospital. And then the people that work in the hospital was like, this is not their fault. They don't have anything to do with anything.
I mean, let's just talk about provider recruitment, okay? If physicians see headlines, you know what I'm saying about hospitals being attacked and stuff. I mean, come on, Eileen. They're not even going to go out there no more. And it's like, I mean, again, it's like when a doctor is going into a hospital and a hospital is onboarding a doctor, they really are entering a relationship where they're both looking at each other.
Yes, exactly.
I mean, right? And it just leads back, to the recruiting, right? I mean, the recruiting, it just makes it very hard.
Whenever you're going to go get a new job, what's the first thing you do? You Google that employer. You learn who the CEO is. You learn who you're going to talk to. And so, of course, it's going to absolutely affect recruitment because physicians want safe environments. They're already under stress. They already know they're going to have a problem and they're going to be overwhelmed because they're going to have an enormous amount of patients to see. But they want to have also a safe environment where they can practice medicine. Political hostility towards a hospital can make it extremely difficult to recruit anyone, not just doctors.
And then, I mean, now if, this is one of Eileen's favorite stories out of Idaho. Here's the criminal, if we want to switch pages, another case that shocked, Idaho, patients, communities is a case involving a psychiatrist, you guys.
Ooh, psychiatrist.
According to law enforcement and court records, you all, the psychiatrist was literally charged, not even joking, with a felony for forcible penetration involving a patient.
You mean he assaulted the person? Oh my goodness.
Like this is a psychiatrist. Like psychiatrists should not be in the vicinity of where penetration could even be happening.
For real.
I mean, I'm just saying, right? And then the investigators confirmed that the literal alleged victim had an established doctor-patient relationship with this doctor.
Well, according to the medical board, the doctor's license, well, you know me, I like to check the license. The license was suspended during the investigation, so they did take immediate action. So kudos to Idaho. But the situation, girl, escalated further. Authorities reported that the doctor tampered with his monitoring device. They had put an ankle monitor on him, okay? And fled the state, girl. He done gone to California. And so he was arrested in California after being hunted down.
Baton, where you at? Did he get a California license, Baton? That's what I'm asking. So cases like this raise major credentialing concerns, right? Questions like we're saying, how quickly can a board and hospitals respond to allegations of abuse? Because literally, if they're already having a hard time, I mean, it just seems like there's already 1,000 obstacles that they're already facing, right?
And not only that, we've always told patients, hey, patients, don't go into a room by yourself when you're going to get examined. But now, even if your psychiatrist supposed to be like, I'm laying on a couch, you're on the other side of the room. We have plenty of personal space. You don't have to listen to my heart. So even in this kind of case, now we have to tell patients, don't go by yourself to see the psychiatrist when that's a very intimate setting and we don't want to have anybody listen to our conversations. Right? So medical boards can impose emergency license suspensions, but hospitals have to initiate their peer review processes and their own medical staff investigations, right? And then those processes determine whether the privileges are restricted or revoked. And then you can report it to the data bank so that you have that paper trail. So that if the doctor does go to another state, we can go ahead and ensure that we are reporting it to the proper entities to help keep our patients safe with all these kinds of doctors.
And, it doesn't even stop there because, I mean, okay, we've talked about the shortage. We've talked about, issues with the hospitals being attacked and recruiting for providers. And so let's just talk about now, okay, we got the doctor, we got the hospital, all the players. And guess what we found out there, y'all? Fraud. literal billing fraud, Nylene.
And every state.
They come out. You're right. You're right. And according to federal prosecutors, when we were looking at this one, a nurse practitioner pleaded guilty to healthcare fraud after participating in what? What do y'all think it was? Telemedicine scam. So now, okay, we finally open up telemedicine. Now we find the people that want to find the loopholes and make it bad for everybody. Because now we know Idaho needs telemedicine. Okay. And I'm sure it took a lot to get it approved through their board and everything. And so now here come the fraudsters. And I just want y'all to know she signed thousands of medical orders, y'all. For what? For what, y'all? For what? Medicare patients.
Of course, the most vulnerable.
And Nylene, here's the thing. She never touched one of them. She never examined one of them via telemedicine.
Craziness.
I know. And according to the court records, the scheme generated over $6 million in fraudulent Medicare payments. Remember, we've taught y'all between the claims and the payments, y'all, they actually paid this out.
That's crazy. And so that's why this highlights such a big compliance issue. When doctors are signing medical orders, or nurse practitioners or PAs, anybody that can sign an order, signs an order without patient interaction, it is massive billing fraud. Y'all, you cannot do that. You cannot do that, because we as credentialing people, we can't
tell them.
We can't prevent all the kinds of fraud. We can do all of our checks. We can do all of that. But when it gets to the billing side of things,
credentialing steps out of that. I mean, really, we do. If there's a problem with the contract, yeah,
we enroll you, we do all of that, but we're not really on the billing side of things. So credentialing teams play an important role in identifying red flags, like maybe looking at billing patterns when we do case logs, like how much case logs do they have? We can get that from the billing records. Or supervision issues, like who's the supervising doctor? Is the supervising doctor signing off on the orders? Are they, but in reality, it's no joke,
It is the reality for me, Nylene. And the reality is how do we get everybody here? Now we can finally see patients, and what we do is we decide to give them some fraud.
I know. That's horrible.
Okay, well, let's talk about this, y'all. There was a great OBGYN exodus that happened in Idaho.
Oh, no. Not the OBGYN.
Exodus, girl. That meaning they left. A major issue that we found that that Idaho was facing right now involves maternal health care. And so that is the health care of a woman when she is pregnant. And according to a study published in JAMA, JAMA, I just like to say it, JAMA.
The journal, the journal.
Okay. Idaho lost, y'all, 35% of its practicing obstetricians between August of 2022 and December of 2024, y'all. I want y'all to understand that is 94 OBGYN physicians left the state in that time period.
Well, and then when an OB provider leaves rural states, the consequences happen, you can feel it right away, because hospitals can close an entire maternity ward. I mean, 94, you're talking if a group of doctors, maybe you have 2 or 3 doctors in a group, how many groups is that? So imagine hospitals may have to close maternity wards, pregnant patients may have to go ahead and then travel hours, girl, people could be delivering babies on the side of the road. Like, it's a true problem.
I know that's right. And according to healthcare workforce,
are you imagining people pulling up to McDonald's and popping out babies?
Honey, that's exactly what I'm imagining. I'm imagining Idaho done had them a drive-through OBGYN. Somebody done opened something up, honey. Because I'm just thinking it's a crisis. According to healthcare workforce reporting, you guys, this has created maternity care deserts. A desert in Idaho. A desert in Idaho, y'all. Okay? Across portions. I mean, I'm not saying the big ones like Boise. Yeah, you probably have OBGYNs in Boise. They popping potatoes out everywhere. But what I'm talking about is
now she called them potatoes.
Well, the Idaho potato is just so famous, But what I was thinking was in the rural parts of the area.
They got
Idaho,
potatoes too.
they got potatoes happening. And they ain't popping out as easy because ain't no doctors over there.
Well, what happens is, right, the doctors are overwhelmed. They're probably like, let me get out of Idaho. I want to go somewhere where I feel more comfortable practicing.
Let me go to California.
Exactly. Just go to California, right? And so then what happens is they leave, and replacing them becomes, really, really impossible because they left.
It's very hard. You have to explain. It's very hard for a doctor to allocate to a new city, especially in a rural city. I mean, in a bigger city, it's easy for us. But in a rural city where everybody knows everybody and they have been living this life for generations together, and now this doctor comes in. I mean, Nylene, how often do we talk about the good old boys and the different things, right, that happen in these type of situations? And so it must be, oh my goodness, it must just be so hard.
Mm-hmm.
So here's the tea. Idaho might look quiet on the map. It might be shaped like a little boop, boop, but the healthcare system is under enormous strain, you guys. And this is why we're really going and taking our Credentialing Chronicles across all 50 states, is because I think a lot of people in our profession, in the medical doctors, when do we think of Idaho? Well, baby, we're thinking about it this week, right? Nylene, we're making people think about it this week. And there's... Tell them there is healthcare system that is under enormous strain. I'm going to say it again. Do you want to just break those kind of what is straining that system, my love?
Yeah, well, then you have the credentialing teams that are working behind the scenes to keep all these systems functioning. We talked about the shortages. We talked about the drama. We talked about all these things happening. And then in rural healthcare, each one of these doctors matter. Every little thing matters.
Mm-hmm. I swear y'all better have a doctor day every month, y'all. Y'all better be treating them doctors so good out in the rural communities. Because like Nylene said, if they're not coming that easy, the poor physician recruiters, you need to treat everyone like gold, right, Nylene? I mean,
yes.
And not even doctors, your nurse practitioners, your physician assistants, I'm sure, your physical therapies. I mean, it takes a community of healthcare providers that want to care for that community. It's needed.
So to the doctors out there, maybe you want to go move to Idaho,
or maybe do some telemedicine.
Or maybe get into some telemedicine. Yeah, exactly.
That would help the people out there. Okay, well, I mean, just go ahead and start it, Nylene. Just give us a PSA to the providers out there. And we're talking all providers, right?
Yes, the doctors, nurse practitioners, PAs, CRNAs, any healthcare professional across Idaho. Your work matters deeply. We appreciate everything that you do, especially in rural communities where you may be the only provider for miles. Be nice to each other, embrace when there is a new doctor. And then also, credentialing isn't bureaucracy. We're just helping you help the system keep and stay safe. And it's really part of helping you maintain the trust of your patients, for your patients, with your patients, and the healthcare institution.
And that's on period.
And exactly. And so, Shannon, what are you going to tell our MSPs out there?
So to the MSP professional teams working behind the scenes, I don't know how y'all doing that out there. You verify education, you confirm training, you investigate concerns and drama, and you protect the standards that keep patients safe. And in rural states like Idaho, your role is even more crucial, or even more critical, even more needed. And so we just want to say, we see y'all out there in Idaho. If you ever need some help, honey, you call me and Nylene, and we will help y'all with whatever we can.
And to your patients, well, to our patients, we want to know that there are MSPs. We do check all of your doctors regardless of where they're at, especially in rural communities. We understand that it's very hard for you guys to get healthcare, but you have the right to know who's providing your healthcare. You can check your providers on the medical board, go on the Idaho Medical Board website. You can verify a doctor's license, review their disciplinary history, ask about their credentials and their training, and you can check everything. Check their board certifications. I mean, just type in Google board certification for Dr. So-and-so and so-and-so in Idaho and put your city. it will come up, or my doctor is a OBGYN, so you want to check their board certification. Those are all things that you can really do. And healthcare really works best when everyone is participating in protecting it and everybody's doing their due diligence to see their doctors.
And there's transparency in the process. And there shouldn't be nothing hidden, you guys. There shouldn't be nothing hidden. Now, what, the doctor ate and what him and his wife did on Saturday night.
None of your business.
That ain't your business.
No.
But how he trained, how he or she trained, how he or she has professional conduct coming on through, that is your business. And so, just respect the lines of a provider, because, honey, credentialing isn't just paperwork. What is it, Nylene? Tell them, babe.
It's protection.
Till next time, like us, follow us, DM us, and we love you. Thank you.
That was a whole nation's worth of tea, girl.
Ooh, and we are just getting started. More states, more scandals, and definitely more receipts.
And if you love the tea we're spilling, you gotta like, you gotta comment, follow us, share, do everything. Where can they do all that at, Nylene?
They can follow us on LinkedIn, Instagram, TikTok, Facebook, on all the things. And share it because the tea is going coast to coast.
Ooh, I love it. See you next time on Credentialing Chronicles. Remember, you got to stay credentialed, but not what?
Not canceled.